Ideal ratio of nurse to patient in ICU is option A 1:2, option B 2:1, option C 1:1, option D 1:3. The answer is option C 1:1. Which of the following is the major cause of maternal mortality rate in India? Option A toxemia of pregnancy, option B hemorrhage, option C anemia, option D eclampsia. The answer is option B hemorrhage. The purpose of postoperative deep breathing and cuffing exercise are to: option A reduce pain, option B prevent wound infection, option C prevent apnea, option D prevent atelectasis. The answer is option D prevent atelectasis. Deep breathing and cuffing exercise promote clean the airway. This will help to prevent pneumonia and atelectasis. Hansen's disease is also known as: option A leprosy, option B tuberculosis, option C smallpox, option D scabies. The answer is option A leprosy. The Hansen disease or leprosy is an infection caused by slow growing bacteria called Mycobacterium leprae. It can affect the nose, skin, eyes and lining of the nose. Which among the following is a complication of spinal anesthesia? Option A dyspnea, option B hypertension, option C hypotension, option D tachycardia. The answer is option C hypotension. Hypotension is the common and immediate complication of spinal anesthesia caused by decrease in systemic vascular resistance and cardiac output. Other complications are urinary retention, transient mild hearing impairment, post-dural puncture headache, direct needle trauma, infection, vertebral canal hematoma, spinal cord ischemia, cauda-equina syndrome, arachnoiditis, peripheral nerve injury, cardiovascular collapse, and death. The formation of cavities filled with fluid inside the spinal cord is called: option A meningocele, option B syringomelia, option C myelomeningocele, option D myelocele. The answer is option B syringomelia. Syringomelia is a disorder in which a fluid filled cyst called syringe form within the spinal cord. The syringe can get bigger and damage the spinal cord. Meningocele and myelocele is a type of spina bifida cystica. Meningocele is the protrusion that include the meninges and a sac containing CSF with skin covering. Myelomeningocele is the condition the unfused portion of the spinal column allows the spinal cord protruded through an opening. There is a covering of skin over it. In myelocele, the spinal cord is exposed on the surface of the back without covering of the skin. Acute or chronic condition characterized by recurrent appearance of wheals causing irritation. Option A dermatitis, option B psoriasis, option C urticaria, option D eczema. The answer is option C urticaria. Dermatitis is the inflammation of the skin typically characterized by itchiness, redness and rash. Psoriasis is a long-lasting non-contagious autoimmune disease characterized by raised areas of abnormal skin. These areas are red or purple. Some people with darker skin, dry, itchy and scaly. Urticaria is characterized by very itchy wheals with or without surrounding erythematous flares. Urticaria can be acute or Chronic. Eczema is a condition in which patches of skin become inflamed, itchy, cracked, and rough. Extravasation of urine into the cellular tissue due to rupture of bladder seen in pelvic fracture. Option A, uric acid. Option B, cystocele. Option C, neurogenic bladder. Option D, hydronephrosis. The answer is option A, uric acid. Cystocele, otherwise called prolapsed bladder, occur when supportive tissue between woman's bladder and vaginal wall weakens and stretches, allowing the bladder to bulge into the vagina. Neurogenic bladder refers to dysfunction of the urinary bladder due to disease of the central nerve system or peripheral nerves involved in the control of micturition. This damage can cause the bladder to be underactive, in which it is unable to contract and unable to empty completely. Hydronephrosis is a condition that distension of the kidney due to obstruction of urine outflow. Most commonly used teaching method is option A, discussion. Option B, lecture method. Option C, demonstration. Option D, role play. The answer is option B, lecture method. The blueprint of what a teacher is going to teach in the classroom is known as option A, unit plan. Option B, course plan. Option C, lesson plan. Option D, master rotation plan. The answer is option C, lesson plan. For effective teaching, duration of one lecture should not be more than option A, 8 to 10 minutes. Option B, 15 to 20 minutes. Option C, 25 to 30 minutes. Option D, 60 to 70 minutes. The answer is option C, 25 to 30 minutes. The teaching which is presented in a dramatic way is known as option A, demonstration. Option B, role play. Option C, symposium. Option D, lecture. The answer is option B, role play.